The Philippine General Hospital is looking at COVID-19 patients who may be discharged or transferred to quarantine facilities. Its 210 beds for coronavirus cases are full. And even if the health department has asked public hospitals to let COVID patients occupy up to 70% of beds when cases spike, PGH said it can no longer expand.
We do have the beds. It's the number of healthcare workers who can actually man and monitor these patients. That is the limitation.
Around 300 PGH health workers got COVID since March. Some are still recovering in the hospital.
If we open up more beds for the COVID patients, then we only get we only get the nurses from the same pool. So the non-COVID patients will not be attended to, and unfortunately, we cannot do that because they're already here in PGH.
The Philippine Hospitals Association says many hospitals are short on manpower and resources, saying there's not enough doctors and nurses left to care for non-COVID patients if the health department's guidelines will be followed.
Iba yung cost talaga na itong management ng COVID. Hindi yung management itself, pero yung precautions, yung mga protective equipment, walang pumapasok na non-COVID kasi pag may pumasok na COVID yan agad sa hospital, wala nang yung non-COVID hindi na pupunta sa hospital. So mawawalan ng income ng hospital.
Former Health Secretary Esperanza Cabral said handling COVID cases is labor-intensive. A regular ward that has 8 to 10 nurses will need twice the manpower when converted to COVID care. Hospitals have teams on rotational schedule for duty and 2-week quarantine. The same goes for janitors and other hospital staff. In ICU, a COVID patient would need 1 nurse. And despite the government hiring almost 7,000 health workers for priority facilities, hospitals like the NKTI said the additional workers are still not enough.
Miski may bed ka pa, kung wala namang healthcare worker na makakatingin dun sa mga pasyente na yon, hindi mo magagamit mo.
Yung mga tao mo, i-quarantine mo yan pagkatapos ng certain so much number of duties. So binabayaran mo sila na naka-quarantine.
There are over 20,000 hospital beds reserved for COVID-19 cases nationwide. Half are occupied. Cabral says the government should find a way to hire more health workers fast. She said the UP pandemic response team sees the cases possibly rising to 130,000 by end of August, and 10% might need hospitalization.
They stay in the hospital an average of 3 weeks. If you have this many patients staying this long in hospitals, you really need to ramp up the number of healthcare workers.
Cabral said focus should be in preparing public hospitals because these are within government control and receive most of the resources. She said the health department cannot compel private hospitals to expand if they don't have the capacity to do so. Caroline Bonquin, CNN Philippines.